The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Mika's heart surgery and Kareem's new kidney. Two-year-old Kareem was born with kidney failure. He has been on dialysis since birth. Through a transplant, he received a new kidney from his mother, Miriam.
Flush.
Several days after surgery, there are complications. Kareem has too much fluid in his belly, and he's showing signs of kidney rejection. His discharge from hospital has been delayed. A biopsy will determine how serious the rejection is.
With the biopsy, sometimes we might have a little bit of bleeding.
Okay.
Usually we do get a bit of bleeding in the urine, and that's normal. So it's nothing to get excited about. And you understand that we're going to put a little needle in and take a bit of tissue out. And that tissue is going to go to pathology. They're going to look at it under microscope and tell us whether there's any signs of rejection or any other pathology.
Okay, sounds good. Because nothing we can do, that's all right.
Okay. That's the best we have.
Yeah,
to the
yeah.
Okay.
Hi. How you doing, big guy? Are you feeling good today? Yeah? Waiting for mommy? No? Can I give you a hug? You okay? Do you want mommy to come with you?
Yeah.
Okay, mommy will come with you downstairs. Okay? But we have to get your gown on and change your diaper and be all ready for when they say it's time to go downstairs.
Six-year-old Mika arrives in Toronto from the Philippines with her aunt and her mother, Minda. She has a hole in her heart which could be life-threatening. She may need open-heart surgery to close the hole, an operation that's unavailable in the Philippines. The Herbie Fund, which assists children in need from other countries, has arranged for Mika to come to the Hospital for Sick Children in Toronto.
It's very big country. Iba ito eh. Hindi Manila ito, nako. This is Toronto. Different, no? So, my daughter is Solaki.
May bahay ka sa Manila? San Quezon City?
Hi, nice to meet you. Hi, honey. How are you? Hi, Mika. How are you doing? Did you have a good flight?
It's a very big hospital. Sorry? Very big hospital. Yes.
Hi. Mika? Mika, hi, Mika. Hi, I'm Dr. Nicolette. I'm the cardiologist. Hi, Mika. Can shake hands? There we go. Good. I'm one of the cardiologists here, and the doctors in the Philippines wrote to me initially, and I'm the person that they were writing to as we were going along. This is Mika's heart, okay? This is her left side, and her right side over here, and her head's up here, and her feet are down here. And these are the two pumping chambers of the heart, and that's where the hole is right now. And that's allowing blood to go from the left side into the right side. And that extra blood then goes off to Mika's lungs and then comes back, and it's making this side of her heart a little bit on the big side. Question then becomes now one of, do we need to do the operation or not? It makes me wonder what the risk of doing an operation is versus the risk of her having sort of a big heart as time goes on. That's why we're going to do this study, this test called a nuclear medicine angiogram. And what that's going to tell me is how much extra blood is going into the lungs. If that test comes back and tells me that there's not very much blood going into the lungs, in fact that there's a very little small amount, then I don't think we need to do the operation. Okay, which would be very good, wouldn't it? That would be the best thing. I suspect that the test will come back saying that she probably still needs to have the operation because her heart looks big to me. So we'll wait for the results of that test and then we can decide if we need to do an operation or not. Okay. Is that good news?
Yes. In fact, I'm really afraid of surgery.
Yeah.
Miss Molly? Halika dito, Miss.
Daniel, not you, Daniel.
Where is the pizza? Here. You know how to add now? 7 plus 7? 14. You know also? 3 plus 6. Yeah, easy. 9. 5 plus 2. 7. Contest. I know, the winner I will give $1. I will give you $1.
One more.
Another. 2 plus 3. 5. 4 plus 5. 9.
Daniel, you're so smart, eh, Mika? Are you smart girl?
Now the nurse will come out to get you in a few minutes. Yeah. You're gonna get a special picture, and then they're gonna put a special needle in your tummy when you're sleeping, and take a tiny piece of your kidney out so they can check it and see how your kidney's doing.
And then I'm gonna hold it?
No, you'll be sleeping. The doctors will get to hold it later.
Does Mika speak English? Yes. Oh, good. Hi, sweetie. I just need to take a little picture, okay? You come down here and I'll show you. I've got some special stickers. Right there. Come on down here. Come on in here, Mika. Oh, you're such a big girl. Now, Mika, can I get you to lay down here? Very good girl. 9 on your chest and your tickly. Boop. And I have one more down here, Mika, okay? One on each leg. There. Thank you. Now, Mika, you see these? See these little wires? Watch what I do with these. And see, every sticker has a little tail, and I just attach it to the little tail, just like that. Wonderful. Okay. Let's see what we have. There we go, and here it comes, a wonderful picture. Perfect. And it's done. We take this off. Want to see it? Look. Pretty neat, eh? That's your heartbeat every time it goes. You see here? You can see all the big stuff.
Yep.
I don't want to, Mommy. Mom's gonna be right here too. And this is Danny. He's gonna be here with us as well. Mommy, I don't want to go now. I don't want to go now.
You know what? You're gonna be okay.
You're gonna stay right here on your bed.
You're gonna stay on your bed for a little
You're not
bit.
going near that at all. I don't want to go now.
No, you're not. You're gonna stay right here on this
Stay right
bed.
here, okay? And we'll close the doors.
I don't want to go in that bed.
Well, then we won't go on that bed, okay? Can we stay on this bed? Okay, then we'll stay on this bed.
On that
Okay.
finger so mommy can help hold your hand, okay?
Ooh,
There we go. And Mommy can help hold your hand there. Yeah.
that looks like a
That's
what?
And this, remember
It's like
the
a
big
car.
muscle test?
This is the big muscle test to see how big your muscles are.
What is that?
Remember that? I think you've had this before. I think you've had this before, right?
The main risks involved are to do with the actual bypass machine, and so being hooked to that bypass machine, we talked about the risks of blood transfusion. But there are two organs that don't like the way the bypass machine makes blood flow: the heart itself and also the brain. The heart doesn't like it just because it isn't receiving a normal blood supply, and sometimes after bypass it's a little bit slow to beat after. In terms of how the brain doesn't like it, a little bit of air can end up being sort of drawn into that tube, or sometimes even a small clot, so the blood can clump together inside that tube. If that clot goes up and travels to the brain, then basically that means the child can have a stroke after surgery. That's a devastating complication, but it does occur. It probably happens about 1 in 200 to 1 in 100 times after surgery, so it's very uncommon, but it does mean that they have permanent brain damage, can have results such as blindness, weakness, or failure to move on one side or the other. Now, did you have any questions about the surgery for Mika? No, nothing else you could think of?
And our patient doesn't want to talk to us right now, so he's sleeping from that. The biopsy report just came out now.
Okay.
And as you know from the ultrasound that was done, we know that the kidney was quite swollen. That's usually about 9 centimeters, and it was about 13 centimeters. So there was this saying something's going on there.
Okay.
And so our working diagnosis in the biopsy, this was a rejection rather than infection in the kidney, and the biopsy confirms that.
Okay.
And there are two kinds of changes you see with a rejection. There is a cellular rejection, or there can be a vascular rejection.
Okay.
We are able to reverse cellular rejections fairly well and not very well for vascular rejections, and he's got a cellular rejection.
Okay.
And we'd say that's a relief, right? And it would be considered mild to moderate.
Okay.
The fact that he's a living related donor, one was hoping we might get by unscathed. Well, we didn't.
All right, got it. Yep. Yep.
Kareem, are you
His
there?
mom is being really
Right.
mean to him.
This isn't his
she, in the
usual
dream?
self.
Get it over me.
I never see him like that before.
No, and it's all me. I'm feeling really guilty about all this. All these dreams are coming out in the moment. Can I kiss you? Don't hurt me. Listen to that, Mommy. Don't hurt me.
Hi, bud.
Well, that was good.
Scary.
Scary but good.
We're gonna go in this room a little bit, right in here, okay? Here, come on this way. Woo! Almost knocked you over. What the doctors want us to do today is to look at your heart and see how the blood's flowing through your heart, okay? It's a really, really quick test. So all we have to do is one icky part. We have to put a little tiny needle in your arm up here, okay? That's the icky part. After that, it's easy, okay? Alrighty, okay.
Madali yung kagaya noon. Di ba ginawa ka ito?
Now, what I'm gonna do, it's gonna be tighter, okay, sweetie? Good girl. Okay, Mika. You wanna hold Mommy's hand with the other hand, or are you okay? I think it's a good idea. There you go. You're very brave. Ready, sweetie? 1, 2, 3, a little out. What a good girl you are.
Wow, that's the worst part.
And that's the hardest part of the whole test.
Good stuff.
Okay. How's that, okay? Doesn't hurt? Good.
We're just gonna undo your buckles because we don't want those buckles showing up in your pictures. We want to see your nice.
measure it for me? Sure. Okay, thanks. There we go.
All set, Rosie? Okay. How long does it usually take? I see. If you could let him know, our decision whether surgery goes on or not is dependent on these results. So I have to contact Dr. Nikkanen with the results. Can I give you my pager number?
Hi. Oh, look at her doing all the numbers. She's going all the way up. Good for her. Fantastic. We have the results of that scan, the one where they did the injection in the veins, and that showed us she's getting close to 1.5 to 2 times more blood into her lungs than to her body. So what that means is that she does need the surgery. And what we're trying to do, it's not that she's sick right now, it's not that she's, that anything bad is happening to her right now, but it's a lot easier to do this now than to wait until she's 30 or 40 or 50 years old to do it, when it'll be a really hard operation to do. But I think what you'll see is that overall the risks of something bad happening with surgery are really, really small, less than 1% chance of something bad happening. So that means there's a 99% chance that it'll go through very, very well. And that'll allow her to grow up, have a normal life, and do everything that she normally would as an adult. Okay? I know you were hoping we didn't have to do it.
Really, I'm scared as a mother.
I would be scared too. As a parent, you're bound to be scared.
I pray for the success.
Yeah.
She is very brave.
Yeah.
I'm only the one who is scared, and
I understand.
I'm forward.
I understand. Hopefully it'll be a memory in a couple of weeks. A good memory.
Yes. For the future of Mika. For Mika to be a beautiful lady, healthy lady soon. No?
Right, okay. Now, they proceeded with the biopsy on Saturday.
Right.
And the results of that shows a mild rejection. But what we also see is his kidney function continued to get better with extra fluids. And so I'm favoring that the major component is that he got behind in his fluids. Not his fault, we dictated that. So today his creatinine is good. We're down to 60, and that's pretty good for him. And if it's 60 tomorrow, he can go home.
Okay.
And so maybe we shouldn't take the blood test tomorrow and just send him home, but we'll see.
No blood pressure, no blood test.
Right.
And we'll be fine.
Okay. Once he gets in the home setting, as I was alluding to you, children do so much better.
Oh yeah. I think it'll be really overwhelming when he first comes home. Just with all the things that there is to do, but I think he'll be better off.
Right. You know what? I think you're going to go home tomorrow morning.
Yes.
You know that? Yes. Does that make you happy? Okay.
You gonna dance? Yeah?
We'll see you tomorrow.
Kareem is discharged the following day.
He's going home. Oh my gosh. Did you need a kiss? Oh my gosh.
Though he will be back for ongoing treatment, the doctors feel Kareem is well enough to go home.
you wait around there? All right, thank you.
She'll take good care, don't you worry. So why don't you come with me and I'll take you to a surgical room. She'll take good care, don't you worry. But later stay here and then you can go and have a bite to eat, don't you worry.
Okay. Precisely right then. Have fun.
On the next episode of Life's Little Miracles, Alexa's chance to walk and Mika's open heart surgery.